I am one of many hats that I wear as outreach coordinator for Missouri Budget Project. This is the month of the Missouri Budget Project staff. Our executive director, Amy Bloom, was here last week talking about the state budget crisis. My colleague Ruth Erishman will be here next week, and then Tom Kruckmeyer will be here well, it's not the final Friday, it's the following Friday, yeah, the fourth Friday. And you will love Tom. He is a character. You will absolutely enjoy him coming to speak to you because he's a hoot. But my duty today is to talk to you about the Farm Bill and the S-chip reauthorization. So please try not to fall asleep during this very stimulating discussion. I was telling Marquita I could go on for a week about each of these issues because they're so in-depth and so detailed. But I obviously won't do that. So I'll try to gloss over the basics as to what's happened recently, where we are, what's going to be happening when they come back from their August recess, and then leave it open to any more in-depth questions that you guys might have before we adjourn today. I also left copies of some papers that relate to S-chip and the Farm Bill on your table. If I didn't leave enough copies, I've got more copies that I can get to you, or we can throw your way during the conversation, so feel free to take those home with you. They're also on the Missouri Budget Project's website at mobudget.org. So where are we? What's been happening with S-chip and the Farm Bill? I'm assuming that everybody in the room knows what I'm referring to when I talk about S-chip. Is there anybody who doesn't know what S-chip is? Well, that's perfect. This is the perfect crowd. So we have been dealing with reauthorization. Both of these bills are up for reauthorization. They have to, the Congress has to reauthorize them by September 30th, or they'll go back into what they like to call level funding, which in my opinion and the opinion of others means it will be a negative funding because it won't be adjusted for inflation. So if the Congress doesn't do their job and pass both of these reauthorization bills, then the folks that will benefit from these two programs will be getting less money in their benefits than they had been getting prior. So it's obviously a huge issue that we make sure that the Congress understands that they need to reauthorize these bills by September 30th. Now, I'm sure some of you are saying, well, do you think that they won't reauthorize them? It's Congress. How do you know? I mean, they get stuck on one issue like immigration and they could be on it for 4 months and not talk about anything else. And so I think it's imperative that we, as their constituency, make them understand that this is something that we expect as voters for them to do. So I'll talk about Farm Bill a little bit and talk about S-chip after that. The Farm Bill has gone through the House, but hasn't gone through the Senate. So they adjourned for August. We'll be coming back September 4th, and the Senate will need to pick that back up. So we need to make sure that our senators understand what the Farm Bill is all about. I'm not going to give you a lot of detail about the Farm Bill. I'm going to talk primarily about the food stamp program that's within the Farm Bill, but I think most of us have most of our interest is in the food stamp reauthorization piece and the nutrition title of the Farm Bill. The House version has allocated $4 billion in expansion over the next 5 years for the Farm Bill, which would make a huge and tremendous impact on the folks that access food stamps in this country, which primarily are children, the elderly, and the disabled. I didn't know a lot about the food stamp program other than just a general working knowledge until I started working for the Missouri Budget Project and started paying attention to the federal issues. And I was appalled to find out some of the details about the food stamp program and the lack of benefits, if you will. Some of them, in my opinion, are non-existent, that were available to the folks that access food stamps. Just a bit of a background about food stamps and its impact in Missouri. A little over 796,000 Missourians, with an average of 86 cents per meal per person, are used by their food stamps each month. Now, I'm assuming that some of you have heard about, it was a couple of months ago, there were several congressional members that were doing food stamp challenges, and Representative Joanne Emerson actually did that and spent a week living on what most folks live on when they access food stamps. If you can go back and archive and research some of the articles that were written in the newspapers about that, she made comments about going into the grocery store, taking the food that she wanted to purchase up to the counter and then having to leave some of it behind because her food stamps wouldn't accommodate what she wanted to purchase, and definitely did not provide for a nutritious meal. So, I'm a mother of a 4-year-old. 86 cents is not going to cut it for a 4-year-old. Even though there's times that he only wants to eat chicken nuggets and fish sticks, 86 cents is not going to cut it. So I think we need to think about that. I always like to pause on certain statistics because we often just run through statistics and don't pay attention to them. But 86 cents per person per meal, that's not a lot. 56% of the food stamps that are received in this state go to households with kids, so it's not just people out there not wanting to work that are taking advantage of the system like most folks on the other side would like to indicate. A little over 47,000 of those food stamp recipients in Missouri are the elderly, and a little over 78,000 are those with disabilities. So like I said, the $4 billion expansion over 5 years would impact the food stamp program and the temporary emergency food assistance program. So that is intended for those folks that, again, temporary assistance program, that $4 billion will be included for that. The standard deduction, these are some provisions that were in the nutrition title that will be an impact for us. And I've got lots of details here. Again, I won't go into all of it, but the minimum standard deduction that 75% of our households receive under this new expansion that the House has passed, keeping in mind that the Senate hasn't passed this yet, this is just what the House is requesting, would increase from $134 to $145 in 2008 and would be indexed for inflation every year after. So that makes a huge impact, just that small difference. And this standard deduction has been frozen since 1995. So when they reauthorized this program before, that hasn't been increased, and it's been frozen since that period of time. So like the rest of us in this room, understanding what our budgets look like from year to year, we have to adjust that, and ours don't get frozen. So we're talking about benefits that make an impression. This is the one that really hit home to me. I don't even know how, and really to effectively pause enough or give you enough emphasis to let you understand what this benefit and this potential increase could mean. The minimum benefit previously and currently, until they expand it, has been $10. So the $10 minimum benefit, which goes overwhelmingly to people with disabilities and those that are elderly, has not been adjusted for inflation in 30 years. So not just since 1995, for 30 years. And under this House expansion, this $4 billion would increase to $16. So the Congressional Budget Office has estimated that this is going to cost over the 5 years $243 million. But I liken it to, what was it, in 2005 when all the significant budget cuts were made in Missouri. And our esteemed governor was talking about waste, fraud, and abuse that he likes to use frequently with everything that he does that basically cuts people off at the knees in the state. They cut a program in Missouri that was the farmer's market voucher program. Some of you are shaking your heads, so you know what I'm going to be saying. And they were talking again about waste, fraud, and abuse, making sure that we could save the state money. That was our priority. Let's save the state money because, we've got to get ourselves out of this budget crisis. That program cost the state $110,000. Not $110 million, not $110 billion, $110,000, and they cut it. So you hear people under this auspice of waste, fraud, and abuse, that there are people taking advantage of these welfare and entitlement programs that don't need it. They go out there and get food stamps, and they're driving Cadillacs, and and they're overweight. Although we could talk about that for a week as to why people who take food stamps are overweight. It has nothing to do with the fact that they're eating, excessive amounts of food. It has to do with the types of food that they're able to get on food stamps. But the fact that we would cut a program such as the Farmers Market Voucher Program, which mostly went to elderly and mostly went to elderly women, and it only cost us $110,000. So are we really in government thinking about how we can save ourselves money in the long run and what we can do to benefit people in this country? I don't think so. So raising this minimum benefit from $10 to $16 will make a huge, huge difference. $6 will make a huge difference. And over 5 years, $243 million. Be interesting to ask Kenny Halshoff, compare that to the spending of the war, to the raising it $6 and what that benefit is. That's probably a reason why they didn't let me in his office. The dependent care deduction, this is something that's important too, and I think probably a lot of people don't realize this, that when you're calculating eligibility for food stamps, in the past, there's been a cap on the dependent care deduction, And under this new provision, that cap would no longer be there. So that means, working households that have to depend on child care would not have to have that as a detriment when they're looking at eligibility for food stamp benefits. And again, remembering back, 56% of the households that are receiving food stamp benefits are those with kids. So we talk again about, the quality job programs, and we want, in this state, our governor and the Republicans want us to make sure that we can go out and pull ourselves up by the bootstraps, be great citizens, and contribute back to the taxes of this great state that we live in. But yet we collectively in the government do not do enough to make sure that those families that are needing to work can have adequate, quality, affordable child care, which falls into this category as well. And this also, there's an underlying piece of this in this food stamp program, making sure that those child care centers have adequate and nutritious meals for those kids. The Missouri used to be, I think we talked about this last week when Amy was here, it used to be 51st, and then I think she said other reports said 53rd in the nation when it came to child care subsidies. 53rd, yeah, exactly. And because the governor, through his waste, fraud, and abuse programs, actually found some fraud in that system, and so he was able to raise that eligibility level up. And so going from 51st or 53rd to 47th now. So we're 47th in the nation when it comes to child care subsidy rates for those families that are out there working every day and want to make sure their kids go to a quality child care provider. So, we're racing to the top, slowly. The other piece that I think is important for us to think about when we talk about the Farm Bill is what's next. So, our members of Congress have taken the month of August off, and they're all obviously just, falling all over themselves to come back to the district and hear from their constituents during the month of August, which is why they're supposed to come back, right, Bill? Isn't that their motivation? Yeah. So when they go back to D.C. in September, if we don't get a chance to meet with our rep and our senators, like Hulshoff and Columbia, when he comes to Columbia, we need to make a point to call, email, write, make sure that our senators understand that we expect them to support the food stamp program within that Farm Bill reauthorization. We would like for them to take the lead and expand that program further, but obviously the minimum is to match what the House is doing. So again, remembering that September 30th is the cutoff. So I'll leave you with, on the Farm Bill, making sure that you make that call. It's really easy to do. And I've talked about this at other presentations I've gone to, and you guys are activists, you hear it all the time. Pick up the phone and call, make sure you talk to your legislator, and you think that it really doesn't make an impact, but it does. On another issue, I was talking to Russ Carnahan, one of his staff in D.C., about another issue that deals with postpartum depression, something that's important to me, and I wanted to make sure that his staff was aware of it. And when I talked to her, she said I was the only person that has ever called their office to talk about that issue. The only person. So it is important for us to pick up the phone, type an email. I mean, we're all on email more than we humanly should be. Just make that effort and let them know what's important. Especially in D.C., they keep a tally of who's calling in and who's for and against. And if they're doing their job correctly, they need to be paying attention to that when they're casting their votes. So on to SCHIP, the State Children's Health Insurance Program. In Missouri, it's our MC Plus program. And this is interesting. Those of you that know me well would probably agree and shake your heads that I'm kind of a dork. Policy wonk, people say policy wonk, I'd rather prefer dork. It's kind of more descriptive. When they were debating the SCHIP last week before they recessed, there was activity going on in the Senate and the House. There was House committees hearing issues on the Farm Bill and the SCHIP. I mean, there's just all this activity. So one particular evening when my husband came home, I had C-SPAN on the TV, and on my laptop I had pulled up one of the committee hearings and was listening to the committee hearing. And when he came in, he's looking at the TV and looking at C-SPAN because most normal people really don't spend their evenings watching C-SPAN. And he kind of looked at me, with this look, and then saw that what I was doing on my laptop, and I just told him, don't even say anything. This is what I have to do this evening because they've got to vote on this before the weekends. When he got done with dinner, he just went in the bedroom. He was like, I'm not even going to talk to her because it's not even going to be worth it. But that whole evening, I was emailing people in D.C., and I was watching these, it was crazy, the activity that was going on, and I'm sure you've been hearing some of the fallback from that. There's been lots of editorial comments and lots of reports on the radio and on the TV about, in fact, I was just telling our table before I got up here that I responded to an editorial that was placed today in the Springfield News Leader by a gentleman, I think his first name is Tim or Ted Lohr was his last name, in reference to the SCHIP reauthorization. And I just sent out an LT to respond to it because basically he was talking about the fact that the Springfield News Leader, and Marquita and I were laughing about this, the Springfield News Leader was not providing enough background to its readers about SCHIP and what the Democrats did with SCHIP. And so, in my mind, knowing what I know about the Springfield News Leader, have they ever really cared about the Democrats doing anything? No, I don't think so. So that was interesting in and of itself. But then he talked about how the Republicans were trying to save the day with SCHIP, and the Democrats basically didn't give him a voice and shut him out of the whole process. What actually happened is that the House and the Senate both passed SCHIP reauthorization bills before they recessed for August, which is phenomenal. It was a huge, huge priority for them. The Democrats came out saying that, and they actually stood by that and went through it. What happened was, because the House has actually implemented PAYGO rules, when they were in committee discussing this, they realized that they hadn't adequately accommodated that, so they had to make some accommodations. Well, Republicans being like they will in that particular committee hearing, which was the night I was watching this is when it was taking place, did what they should have done. I mean, Democrats would have done it too if the shoe had been on the other foot. Used some procedural moves, and the bill itself is like 468 pages long, so a really easy read, you know, print it off tonight and read it before you go to bed. Continue to request that the clerk read that bill before they voted on it. Well, occasionally she would make a misstep, miss a word, mispronounce a word. They would make her start from the beginning. So, yeah, finally by about, I don't know, 10 o'clock that night, she had to take a break. Somebody else had to come in and start reading the bill for her because she couldn't even talk anymore. So it was quite an interesting process in what they were doing. It was, you know, for someone who's a dork like me, it was quite interesting. But finally, the Democrats just said, enough is enough. We have the ability, as the majority, to say this bill's getting voted out and it's going on the floor for debate, which is what happened. But the other side would lead you to believe that the Democrats cut off debate, would not allow them, brought the bill to discussion at the 11th hour and just sent it in just so they could run it through. That wasn't what happened, of course, you know, depending on who you hear that from. So, the House version is the version that I happen to like. It expands the program, the SCHIP program, over the next 5 years by $50 billion, which is exactly what the Congressional Budget Resolution offered at the beginning of the year. They talked about what should be offered, what would be the appropriate measure in order to expand SCHIP. The Senate, their version, is only $35 billion. The differences there are the number of, and for those of you that are familiar with the MC Plus program, there's a significant amount of kids that are eligible for SCHIP or MC Plus, but are not enrolled. There's various reasons as to why that happens, and you know we could go into that, but I think we generally have an idea as to why that happens. And so there's been lots of incentives about trying to enroll kids in that program and how to make that happen, and it hasn't happened. So you've got eligibles, but they're just not in the program. So the more you can insure those kids, obviously the healthier they're going to be, the better your state's going to be. So that $50 billion expands that program, gives a more bonus incentive to the states to be able to enroll those kids into that program, and also offers some incentives back to the state, you know, money back into the state to be able to do that. The Senate version does not do that. There's been again, the PAYGO rules come into play here. You've got to find offsets. The only way in order to pay as you go is to find offsets. So take your money from another program, or you know, cut a program, eliminate a program, put it into your program, which is not likely to happen, especially in DC, or raise revenue. And we all know how difficult it's been to raise revenue in this state, much less, you know, federal revenue. So the proposals on the table are in reference to the federal tobacco tax and to Medicare Advantage overpayment, which I will not go into detail on Medicare Advantage overpayment, but needless to say, The other side is saying that the Democrats are trying to ramshackle the Medicare program with their proposal. That's just not true. Those of you that are either intimately involved with the Medicare program or have a working knowledge of it know that there is an extreme, in my opinion, abuse of payments going to providers, hospitals, pharmaceutical companies, and such. So there is room there. And in the federal tobacco tax, which would tax not only cigarettes but also any other tobacco products, the House is suggesting 61 cents a pack, which would up it to $1 a pack, which is extensive, but would raise about $40 billion, depending on who you talk to. And the Senate is only looking at 45 cents. So, the tobacco industry and the insurance lobby, surprise, surprise, spent a buttload of money the last few weeks before they recessed on ads in target states with senators that they felt like they had some influence over. Missouri was one, being because McCaskill's new and because Bond is Bond. Get in here, Judy Baker. You're late. Are you a legislator that's out working or something? I don't understand. And the insurance companies, because obviously they want to keep their profit where it needs to be and not back to the people that actually buy their services. So they really put a lot of effort and a lot of money into this. You had lots of people talking about that these states that were going to be getting this increase would become donor states, which if you're not familiar with what that means, they're claiming that because of the revenue that would be raised from the increase in that tobacco tax, for example in Missouri, that we would never be able to spend or receive enough services to offset that revenue. So we'd be just getting this influx of money that we would never benefit from, which I don't see that happening either, but that's their viewpoint. So we've got both bills passing in the House and the Senate, and we've got September 30th is a deadline there as well. So now we have to conference. So now we have to compromise, which sounds great, but probably isn't going to work too well, by September 30th. So we need to make sure that we're talking to our reps and our senators about, depending on who they decide as their conferees are, making sure that we influence that decision. Obviously, the more the better, in my opinion. The $50 billion would be the best possible program that we could have. There'd be more kids that would be insured. You've got people saying that, I think Amy alluded to it last week, that people, like myself who has private insurance, would be kicking my kid off private insurance to put him on the state rolls, which is completely asinine, quite frankly. So that's not going to happen, but they want to make you believe. In fact, when I talked to Bond's staff, even though Bond and McCaskill both voted to support SCHIP, which is great, we would thank Senator Bond for that, even though his staff told me that they firmly believed that these wealthy Missourians were going to be putting their kids on SCHIP. So he believes that, or at least he's propagating that when he's talking out in public. So they still need to be discussed. Those issues need to be discussed with them. The other issue is that our president, the one that has the two books, one of them being a coloring book in his bathroom, has threatened veto on this SCHIP legislation. So, yeah, because he said when he brought his budget out that he didn't want there to be any increase in these domestic programs because we've got a war to fight and we need to put our money over there, even though they don't have armor and whatever else. But when the House passed it, it was a veto-proof pass. So they have enough support between Republicans and Democrats that if he wants to keep threatening that, go for it, Mr. President. I don't think it's going to happen because if you're going to put kids up against the war, I'm pretty much sure that the kids are going to win out. So I think he's threatening that for a variety of reasons, and most of it's because he gets money from tobacco and insurance. But whether he follows through with that is still yet to be seen. He might, because he's a decider, and he's also a cowboy or something, I think. So he may still do that because he's not the most brilliant guy in the world. Let me see if there's any great statistics that I can give you here. Oh, the Families USA, which is a great organization, not-for-profit national organization that has a lot of information about SCHIP and other programs. They have a recent report that's specifically for Missouri that estimates that there are a little over 121,000 uninsured kids in the state. And those are kids that are eligible, not those kids that have parents that make $90,000 a year. These are low-income kids. These are kids that are eligible. So 121,000 uninsured kids, that's 121,000 more than I would like to see. The other issue before I stop talking to you, Missouri is one of the few states, and Judy might be able to expand on this more. She and I have been talking about this over the last few weeks. We provide eligibility up to 300% of federal poverty level when it comes to our program here in the state. And Senator Bond and many other Republicans are very concerned about that because they think that that's going to just lead us to going to 400 to 500 to 600% of federal poverty level. So there's been amendments that were floating around. They got defeated, but they're going to be brought up again during conference to cap that at 200%. So there's states that it's not going to be an issue because they're not where we are in Missouri, but for Missouri that's going to mean even more uninsured kids. So we need to also, in our messaging to our senators and to our rep, tell them that we need to maintain the status quo, at least in this reference when it comes to Missouri and what Missouri offers. So 300% is at risk. I think that's it. I've basically gone over the general synopsis of where we are with SCHIP and the Farm Bill. Again, not to be redundant, but it's important for us to make phone calls, to send those emails out to our rep and our senators and make sure that they understand how important these two issues are. I have developed a very good relationship with Representative Joanne Emerson and would say that she has some leanings more towards the Democrat side than she does the Republican side on some issues. She's been a great leader on the Farm Bill, and especially for food stamps. Obviously, she's following in the footsteps of her husband, what her husband did when he was there. But Republicans are movable on these issues. We often have a tendency to think that you just can't talk to them, nothing gets through, and in some cases that's true. But there are some that are moderate enough, and Emerson is one, that we really can make an influence. And even though someone like Emerson, who has been a leader on this issue and knows it, like the back of her hand, still needs us to contact her, still needs us to make sure she understands what the important level is. Because when you, like in the SCHIP legislation, I did fail to mention one thing that I wanted to point out. In the SCHIP legislation, when they were voting on it in the House for Missouri, all of the Democrats voted to support SCHIP, and all of the Republicans voted against it. So there was not, in Missouri, a bipartisan approach to it. And even though Emerson is a moderate in some areas, this is still an issue where she could be shored up on, and we can make sure she understands. If she understands and gets it on food stamps, then why in the heck can't she vote to support it on SCHIP? Because it's basically, canceling out those two votes. You got hungry kids, but yet if they don't have insurance, that makes no sense. And so, even in that case, the party line influence still comes into play. So, like I said, I could talk to you guys for 2 weeks on each of these issues, and I won't. So, I'll stop and answer any questions.